we are starting with the foundation knowledge and then building so that those participants will finish the course with a certain level of expertise in the procedures that we are teaching.
I think what's different about the KNACK track is that the individual pieces are built on each other, and you really start with the foundation, and then you get to more complex surgeries as you build that foundation and get more comfortable with it. We really try to combine the theoretical knowledge and then build on that theoretical knowledge that's not just associated with surgery, but also with the medicine, the diagnostic workup, and then progress through actually performing the procedure and the postoperative care.
This is only the first in a series. The idea of the KNACK track is that it builds on one another and it becomes a series of courses. In this case, we're focusing on the urinary tract.
The KNACK track for the urinary tract would start with the basic diagnostic procedures, the foundations of surgical technique, and then go into the specifics of basic urinary tract surgery. And the idea is that then subsequent KNACK tracks offerings would be building into more complex and more advanced urinary tract surgeries.
Only those participants that demonstrate expertise based on the rubric for the key outcomes assessment will earn the badge of KNACK.
This course system helps to bridge the gap between knowledge, theoretical knowledge, and real-world application by only focusing on a certain set of diseases, the diagnostics and the treatment, and incorporating the diagnostic workup into the surgical procedures and the postoperative care. We can really focus on one system, in this case the urinary tract system, and go from theory with evidence-based support through the technical and practical applications, both of the diagnostics and the procedures that actually treat the disease.
The KNACK track courses are very limited, so you have a 4-to-1 participant to instructor ratio. In addition, each participant has their own cadaver. We all work as a team in order to learn together how to do these different procedures.
Anybody who's interested in surgery and wants to improve their surgical knowledge and skills should consider taking the KNACK track courses. There's going to be an excellent ratio of instructor to participants. There will be some feedback as to the proficiency of performing the procedures. Any general practitioner or emergency doctor who is interested in increasing their surgical portfolio should consider taking this course.
This is a course that's not only meant for those seasoned veterinarians who maybe have been doing surgery for a while, but also for recent graduates. You can get the opportunity to practice different procedures one-on-one with an instructor.
If a veterinarian is intimidated by surgery, I would say that's actually a good thing to start. I think as a surgeon, you have to be somewhat intimidated, yet confident. And the KNACK track is really aimed to take some of that intimidation away and build some of that confidence. But if you as a surgeon are intimidated initially, I think you're much more likely to be a safer surgeon in the future. The KNACK track is actually perfect for somebody who's a little bit intimidated by surgery because you get that really focused instruction, both theoretically and practically, that allows you to really build your skills one bit at a time, rather than, as often is the case in these CE offerings, have a pretty wide variety of surgical procedures that can feel somewhat scattered and be quite overwhelming.
We've all made mistakes, and so this is an opportunity to learn from each other's mistakes and learn how to not make those in the future. The great thing about this particular course is that, as we've said earlier, there's a very limited number of participants, so the instructor to participant ratio is 1-to-4, and we also will finish the course with an assessment, giving you real-time feedback as well as feedback following the assessment, so that you know those areas that you can continue to work on and improve your surgical skills.
One of the big differences between the KNACK track courses and the regular or traditional CE course is how focused it is on a specific body system to really hone down the skills in a very defined set of surgeries rather than a wide variety. You can do this if you had doubts about that, or you will feel that you really learned a lot about this specific set of surgeries and procedures.
And after this course, I feel that you will have that confidence to be able to operate the next case, knowing that you are able to do the procedures to the level of the rubric and that expertise. And also you will have developed relationships with those instructors and your other participants so that you have someone to call when you have a question. We hope to see all of you at the KNACK track for the urinary session and help launch WVC Nashville.